Hello, my name's Zach. I'm a Saginaw Valley nurse practitioner student here to do an assessment on you today.
Okay.
First, I'm going to have you walk over here. We're going to be 20 feet from this Snellen chart. If you could read the lowest line that's clear to you while covering your right eye.
DEFPOTEC.
Okay, and the other?
DEFPOTEC.
All right, 20/20 vision in both eyes. I'm going to have you walk back here, assessing your gait. Your gait has appropriate pelvis shift, hip and knee flexion, and it is steady gait. From here, I'm going to assess the Rosenbaum chart. I'm going to hold it 14 inches, and if you could read the lowest line that's clear to you.
ECTPNL.
All right, and the color bars?
Green and red.
Yeah, so we have 20/20 vision with corrective lenses, binocular. Next, I'm going to assess the structures of your eye. If you could take your glasses off, I'm going to look at your sclera. It's white, cornea is intact, conjunctiva is moist and pink bilaterally, conjunctiva sac is moist and pink and patent, iris is intact and same color bilaterally, hazel. I'm going to take a look in the light here. Eyes are consensual and they do react to light. They go from approximately 4 millimeters down to 2. If you can go ahead and put your glasses back on. Next, I'm going to do a test here, looking for conjugate gaze. You can follow my finger with just your eyes. All right, no extraocular eye movements are noted. I'm next going to test for convergence. Take a look at my finger. All right, convergence is noted. Next, I'm going to check for accommodation. If you could look at my finger and then look at the wall behind me. Accommodation is also noted. I'm going to turn some lights down here. I'm going to check for the red light reflex. About 24 inches away. Red light reflex is intact. Next, I'm going to take a look in your eye. Looking at the vessels are intact. The optic disc is intact. I'm going to look at your other eye as well. And it's the same bilaterally. Optic disc intact, vessels are intact. All right, from here I'm going to just set up here. I'm going to take a look in your hair. If you could pull it out of a bun. I'm looking for skull symmetry. Your skull is symmetrical. Do you have any pain or tenderness on your scalp?
No.
I'm going to be looking through your hair. It's well distributed. The texture is appropriate and healthy. I'm looking for any infestations or lesions or scaling, dandruff. It is negative. Thank you. Next, I'm going to assess for the trigeminal nerve. If you close your eyes and then let me know when you feel it and where it's at.
Forehead. Forehead. Cheek. Cheek. Chin. Chin.
It's intact. Next, I'm going to palpate your sinuses. Do you have any pain or tenderness there?
No.
I'm just going to percuss lightly. All right. Sinuses are clear. I'm going to take a look in your nose. There's no deviated septum, no polyps. Mucosa is moist and pink. Turbinates are not inflamed. I'm also going to have you close your eyes, and if you could blow your nair. Other nairs are patent. I have a smell here. If you could smell this, let me know what that is.
Alcohol swab?
Yeah. And over here?
Alcohol swab.
Good. That was checking for the olfactory nerve. From here, I'm going to go into assessing after the nose. I'm going to assess for any pain or tenderness in your ears. Do you have any hearing issues?
No.
I'm going to pull up on your auricle, pull on your tragus, checking for otitis externa. Do you have any pain there?
No.
I'm going to press on your mastoid for otitis media. Do you have any pain there?
No.
Okay. I'm going to do a whisper test. I'm going to whisper a word and cover this ear. Let me know the word.
TikTok? Hilltop?
Good. That was checking the vestibular cochlear cranial nerve. I'm also going to take a look in your ears. Alright, there is no cerumen. Tympanic membrane is pearly gray. Conal light approximately 7. There is no cerumen. Tympanic membrane is pearly gray, and the conal light is approximately 1300. Next, I'm going to do a Weber test. Let me know if you can hear this on both sides and if it's equal.
Yeah, I can hear it. It's equal.
That was for lateralization. Next, I'm going to do the Rhine test, looking for bone conduction. Let me know when you stop hearing this, okay?
Now.
Can you still hear?
Yeah.
I'm going to do the same over here.
Now.
All right, air conduction is greater than bone conduction. Next, I'm going to take a look in your mouth. And you say, ah. Uvula is midline. The tonsils are not inflamed. Checking the vagus nerve. I'm also going to check for a gag reflex. That is assessing for the glossopharyngeal. And then if you could stick your tongue out and to the side, another. That's the hypoglossal. They're all intact. He had a moist pink mouth. Gums were not inflamed. From here, I'm going to assess your neck. I'm going to palpate for the trachea. Trachea is midline. Tracheal rings are noted. Palpating for the thyroid. No masses or nodules were noted. I'm going to next palpate for your occipital, lymph nodes, post and preauricular, submaxillary and submental, supraclavicular. They were not palpable, which is a normal finding. I'm also going to next assess your spinal accessory, which is if you could push against my hand and the other. Good. And shrug. And can you puff your cheeks out, smile, frown, raise your eyebrows? That was checking for the facial nerve. And then if you could clench your teeth for the motor. Good, they're intact. Next, we're going to go into the respiratory assessment. I'm going to check your AP diameter. You could raise your arm there. AP is approximately 2 to 1, which is a normal finding. I'm going to palpate for chest expansion. If you could take a deep breath in. Expansion is symmetrical. Do you have any tenderness in your back?
No.
I'm going to palpate for tactile fremitus. Can you say the word 99?
99. 99. 99. 99. 99. 99.
No tactile fremitus was noted. I'm next going to percuss for resonance. Resonance is noted. I'm going to auscultate your lungs. You take a deep breath in. Lungs are clear to auscultation, no adventitious sounds. Regular rate, approximately 16 per minute. Normal effort, no retractions are noted. And I'm next going to do a cardiac assessment. I'm going to listen for any carotid bruits. No carotid bruits are noted. I'll palpate your carotid. They're equal bilaterally. Then your brachial, radial, dorsalis pedis, and posterior tibialis. They are 2+ and equal bilaterally. Next, I'm going to have you lay down here. I'm going to auscultate aorta, tricuspid, pulmonary, Erb's point, auscultate the apical pulse, and also note the mitral valve. I'm going to auscultate for any bruits, tricuspid, Erb's point, and mitral. No murmurs were noted. I'm going to palpate for any thrills, or I'm going to feel for any heaves or lifts and thrills. Is negative. I'm also going to palpate for the PMI. PMI was palpated. Apical rate was around 60. You can go ahead and sit up here.
Thank you.
Do you have any questions for me?
No, not that I can think of.
That'll do it. Thank you.
Thank you.